Thank you for that. The next question goes to Scott Bauer at the Associated Press. Scott Bauer.
Hi, thanks again for doing this call. Julie, just wondering if there's any thought being given to moving up the May 1st general eligibility date, and whether the recent uptick in positive cases makes changing that May 1 date more or less likely.
Well, Scott, we're constantly evaluating where we are at in terms of vaccination. As you know, it's only been since Monday that we started with this new group of over 2 million people with chronic diseases, and they are, of course, people who are at higher risk than the general population. And so we certainly want to give time for folks with these chronic diseases to get into the vaccine system, to make appointments. We also want to watch where we're heading with vaccine supply. As I've mentioned previously, the federal government has promised that vaccine supply is increasing. That's why President Biden indicated May 1st would be the date we'd have adequate supply to move faster into everyone being eligible for vaccine. And we're starting to see that. Our vaccine supply for next week, as I mentioned to you, we've seen very, very low amounts of Johnson & Johnson since that initial shipment we got in early March. And as promised, we're seeing higher levels of Johnson & Johnson promised to us next week. We'll be receiving about 35,000 doses of J&J, so that's a net increase in our vaccine supply. We'd like to see a little bit more than that before we're ready to move to the general population. So we continue to evaluate, and we will keep you posted.